Hello, this is Miguel Gomez with AIDS.gov at the Mobile Health Conference in Stanford with the coordinator. Sir, could you introduce yourself?
I'm BJ Fogg. I direct the Persuasive Technology Lab here at Stanford.
I'm Eric Buhi, and I'm an assistant professor at the University of South Florida College of Public Health.
Brett Mendenhall. I work as the assistant executive director for CHIPS, which is a HIV research center at UCLA.
Yes, Dr. Cheryl Smith with New York State AIDS Institute.
My name is Albert Daniel Ramos, and I work at the East Bay AIDS Center, Downtown Youth Clinic in Oakland, California.
Christopher Branson. I'm a child psychologist at St. Luke's Roosevelt Hospital in New York City.
What was the objective of the Mobile Health Conference?
It's to accelerate what people are doing with mobile technology to promote health of everyday people.
You're here at the Mobile Health Conference to learn more about mobile applications. Why is that important to your work?
Working with HIV-positive youth, or just working with youth in general, one thing that I've learned is that in order to really engage youth in discussions around how to better comply with medications, how to deal with stigma of HIV, how to help them disclose their status to their family and sexual partners, we really need to be able to engage the youth. We need to speak to youth with language that they can understand.
We are actually very excited about mobile health, specifically in the HIV arena. We would like to have all agencies identify their audience and really engage.
So mobile technologies are really useful. We know, at least I know from my research, that people meet sex partners online, people look for health information online, and now mobile devices can connect on the internet and can be used to facilitate both those things, for meeting people as well as looking for sexual health information, HIV testing sites, and so that's why that's important.
I think it's really critical that we start to explore these, and really I think it's important to meet people where they're at. So if people are using texting or other forms of mobile technology, we really need to implement these both in research and in care.
Your clients also want you to be using cell phones. How are you responding to that request?
Absolutely. So we've started off small just with text message appointment reminders for our clients. Now we're starting to use it in therapy, collecting information from some of our clients, and now we're even looking to do continuing care for clients living through text messaging.
What advice do you have for the HIV service community?
Well, I think research matters, but there's ways you can do research very quickly. Mobile, I'm big on texting. I don't think texting has been explored enough of the possibilities there. Mobile, absolutely vital. It is the persuasive technology of the future, especially for younger people. If you're going to change their behaviors, you've got to figure out how to do it through mobile, so it's enormous. Watch what's working. You don't have to reinvent the wheel. There are thousands of companies doing these trials, and a government agency doesn't have to be doing something completely off the wall. Watch what's working, track that, and then imitate success.
I say go for it. I think it's really important to speak the language of the people that you're working with, in a sense.
And if people want to learn more about your work, where do they go?
People can learn about my work as well as the work of my colleagues who study sexual health and HIV at health.ucla.edu, and you can search for CRUSH, which is the collaborative for research understanding sexual health, and that's our research collaborative, which is students and faculty all across USF.
Go to chipts.ucla.edu. That's chipts.ucla.edu.
Please visit us at downtownyouth.org. Again, that's www.downtownyouth.org.
Well, we'll be posting slides and sharing those, and we hope to do a conference next year. The current website address is mobilehealth2010.org.